Hello and welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Cindy Duet, the Vice President of Clinical Ancillary Services at Terrebonne General Health System. Today we will discuss Community Health Improvement Week and how Terrebonne General is working with community partners to improve the health and well-being of our community, particularly those who struggle with access to care. Welcome to the show, Cindy.
Thank you, Rhonda. It's a pleasure to be here.
All right, well, let's get started with you telling us a little bit more about your role at Terrebonne General Health System.
So I've been with Terrebonne General Health System for a very long time. I started in the late 80s as a baby pharmacist. I'm a pharmacist by background, and I've had the honor of working pretty much every role in the pharmacy, and then I did some organizational leadership training for a while, and now I serve as the vice president over the clinical ancillary areas, like the lab, the pharmacy, x-ray, and quality, and I'm involved in the community health needs assessment process as well.
All right, well, that's a huge role. Lots to
Keeps me
do.
busy.
Keeps you busy. All right, well, let's talk about the significance of Community Health Improvement Week.
Sure. So Community Health Improvement Week is a week that's nationally dedicated to honor those hospitals and community partners and healthcare organizations that strive not to give just acute care, but to really reach out into the community and improve the wellness of the community for now and future generations to come.
Are there any specific strategies or approaches that Terrebonne General uses to improve our community's health?
Yeah, Terrebonne General is involved in a variety of strategies to improve health of our community. It's really been interesting to watch the evolution through my time with the organization. When I first started working here, we focused on you come to us for acute care treatment, and across the 30 years or so I've been here, it's now that we are out in the community hoping to advance health and wellness instead of treating illness. So it's been a really neat evolution. And you'll see us out and about through community sports, through Market at the Marina, through Project Lead, and most recently our mobile clinic bus that'll be out and about. So we have a ton of strategies to help improve health and wellness.
All right, and what is the Community Health Needs Assessment?
So the Community Health Needs Assessment is a process we go through about every 3 years. It takes about 8 months because we start with some data, community health rankings, parish health rankings, state health rankings. We look at populations and demographics, and we pull all of that information together to show us what are the needs in our community, and then we strategize to help figure out how to best address those needs.
Okay, and can you explain the process of conducting the Community Health Needs Assessment?
The process is quite intensive, as you are well aware of. We start with, like I said, the data. Everything starts with data, scientific, but we also involve and we reach out to various community leaders, various organizations, governmental, healthcare related, needs related, social determinants of health related. We pull all those people in. We send out a public survey for the public to help answer. We pull everybody back together and kind of work as a group through those to figure out what is the greatest need and how can we have the greatest impact across the parish.
And what are some of the key findings or specific health concerns that were identified?
So we were able to identify at least three, we call them 3 buckets. One has to do with chronic diseases. The other has to do with promoting health. And the third one has to do with access to health care. So in promoting health, what we identified is chronic diseases, especially due to our lifestyle and heritage in Terrebonne Parish. You'll hear this across the board, but diabetes, heart disease, and hypertension management, cancer, obesity, and overweight. Unfortunately, us as a nation, and especially us as a parish, has a great proportion of people that have challenges in being at a healthier weight. And then access to care. Do we have enough providers in the area to maintain the health and wellness? And is there different ways to access that, like using telehealth versus a traditional physician's visit?
All right, and we're adept to handle all of those.
Yes, we are.
And so what are some successful examples of programs or community partnerships that Terrebonne General has to help identify these specific health concerns?
One of the greatest partnerships, I think, has been the partnership with the downtown organization and the development of Market at the Marina. It started out really small, and lately it is up to 80 or 90 vendors at a time. There's fresh fruit, fresh vegetables, a variety of educational offerings around obesity, diabetes. We're offering health screens there, especially for Market coming up in June, using the mobile bus. That's one great example. A second great example, which I actually was part of, is Project Lead, where we use healthcare professionals to go out into the schools and do educations about the consequences of choices you make beginning at an early age, beginning from 4th grade on up. So that's been a great partnership with the DA's office as well.
And how have these partnerships contributed to the improvement in our community's health?
So the improvement in our community's health can be seen as we continue to increase access to care via a traditional visit, the mobile bus going to you, or you calling into us with technology to use telehealth, which was really used a lot in the last couple of years due to the COVID pandemic. There's lots of educational opportunities out there. I always say knowledge is power. So until you really understand your chronic condition and have some education on that, then you can better management and have some longevity and impact your healthcare outcomes. And we've seen some success in those areas as well.
Okay, what is the one key takeaway you want everybody to know?
The one key takeaway I want everyone to know is that Terrebonne General is here for you in illness, but more so in health and well-being. And we really care about our community, and we are focused on improving the health and wellness of our little ones and for generations to come in the future.
All right, well, thank you, Cindy, for sharing this helpful information and for all that you're doing for our community.
Thank you. Love to be here.
For more information about the Terrebonne General Community Health Needs Assessment, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.